Hello everybody, cheers from Sri Lanka. I welcome all of you who are virtually gathered here for the second day of the Relocation Symposium 2020 to gain insightful views from the scholastic excellence of the researchers from Asia and Pacific region. So let me introduce myself briefly. I am EGI Sevwandi, a temporary lecturer attached to the Department of Geography, University of Peradeniya from Sri Lanka. So today I will be presenting my study on COVID-19 disaster prevention mechanism undertaken by Sri Lanka in the form of a SWOT analysis. Um, Here you can see my presentation outline, which is the locating Sri Lanka in South Asia at first, because you may not know my country, which is a tiny island in the mighty ocean of the Indian Ocean. So then I would be moving to the introduction regarding the COVID-19 emergence in the Sri Lankan context, and then to the conceptual background, the methodology, following results and discussion, conclusion, recommendation, and some selected references. Here you may see the location of Sri Lanka approximately close to the Indian subcontinent, and you may see the coordinates, which means the absolute location and the relative location in Sri Lanka near to India. So my country is renowned for the gentleman's game of cricket, and as a country which exports the best quality tea, and as well as for the hosting nature of Sri Lankans. Moving on to the introduction part, you may see the emergence of COVID-19 in the Sri Lankan context. So Sri Lanka reported the first case of COVID-19 from a Chinese tourist on 27th January 2020, and then subsequently diagnosed its first local case on 11th March 2020. So the onset of COVID-19 epidemic in Sri Lanka was triggered, and it was associated with the tourism industry. And however, the Sri Lankan mechanism to prevent and control the COVID-19 situation in the country was led by the government, and the government enforced a strict strategy of case detection, identification of contacts, quarantine, travel restrictions, and isolation of small villages as well, which is changing the strategy in a timely manner to accomplish positive consequences. And so far, the country has been successful in confining the epidemic. Actually, I should mention that my study was completed by the 3rd of August 2020, but now the situation is quite controversial here, because today also we have about 87 deaths recorded in Sri Lanka, which is quite controversial for the people, that we are susceptible, whether we would also be infected by the diseases, which was quite deviating from the situation of Sri Lanka, which was there while I was completing this study. So as you can see here, this is my conceptual background. It was purely a SWOT analysis. So SWOT is generally used by organizations as a decision-making component, including internal strengths and weaknesses and external factors of opportunities as threats, as you can see in this figure. So SWOT is used in preliminary stages, as I mentioned, to go as a decision-making tool in order to find a solution, considering many factors which are different from internal and external factors. So my study was aiming at maximizing the potential of the strengths and opportunities while minimizing the impact of the weaknesses and threats in order to achieve best results for my country. So my analytical method adapted here is considering COVID-19 as a disaster for the country of Sri Lanka. Here you may see what are meant by the internal and external dimensions of SWOT. So SWOT means qualities that enable to accomplish the overall mission of capacity building and its respective components, while weaknesses can be defined as shortcomings that prevent the system from accomplishing its mission and achieving the full potential of its area of capacity building and its respective components. And opportunities can be defined as within which the capacity building systems operate and arise when an initiative can take place and benefit its conditions in the environment, and threats can be categorized as arise when conditions in external environment jeopardize the reliability and success of the capacity building effort. So as you can see in this slide, my methodology for this research endeavor is purely undertaken based on selected number of research papers, government documents, reports from reliable sources published in the renowned and widely accepted academic websites during the last few months on as electronic versions. So the research methods adapted here is comprehensive literature review covering vast arena of national level indicators, social components and cases that were impacted by the COVID-19 pandemic, and the weight of the research papers utilized for this study can be seen in this figure. So as you can see, most of the research articles focus was on economy, while a less number of research articles could be examined, focusing on media and information's role during this lockdown and pandemic situation. Moving on to the most important part of my study, which is the research and discussion, I can give you a little summary regarding the results and discussion, which means even though it was a fresh experience for Sri Lanka to combat the pandemic which is spreading rapidly, our country has so far achieved a tremendous achievement in prevention. So, being a Sri Lankan and proud Sri Lankan, I would like to say this because Sri Lanka has its own success story regarding the prevention and control strategy of COVID-19, especially in the context of South Asia, which aims at regulating, restraining, correcting, or restoring the disease to normal. So the SWOT analysis that was conducted by me is performed by the essence of the research articles and web resources-based literature analysis, which can be elaborated in the next slides. As you can see here, I have listed out the strengths that was extracted or absorbed by the literature review, which was done in depth. So the first strength is about implementing social distancing strategies. So here social distancing means the nationwide curfew, quarantine lockdowns, travel restrictions, and isolation of villages at a very earlier stage of disease spread. The second point I have listed out here is strong intelligence base for contract tracing, including prompt contact tracing and isolation, border closure, and complete lockdown. So it's important to mention that a study conducted by Ranavira and his colleagues has developed a web application utilizing an epidemiological model to support decision making that enables visualization of cases and ICU bed requirements with time, with adjustable parameters that include population exposed, proportion asymptomatic, number of active and recovered cases, infectious period, RO doubling time, proportion critically ill, available ICU beds, and duration of ICU stay. So these studies or these research endeavors have motivated for the coping mechanism or the prevention mechanism of Sri Lankan COVID-19 situation. The third point I have elaborated here is innovations to locally substitute the medical needs. So in order to successfully address the bottlenecks in expanding testing to desired level due to shortage of equipment such as personal protective equipment and test kits, inventors are motivated by the government and Sri Lanka Institute of Nanotechnology to research anti-epidemic solutions such as face masks, hand sanitizers, and rapid testing kits. Regarding the coordination and cooperation among government institutions, I should mention that Sri Lankan government formed a presidential task force in relation with fighting the COVID-19 virus, which seeks cooperation of all sections of the society. So the first quick sessions emphasize the disastrous consequence of behave in irresponsible manners and importance of the cooperation of everyone to the quarantine process commenced with the objective of protecting citizens of Sri Lanka. Moreover, as you can see in the slide, donations were given from local and international community to strengthen the health system of Sri Lanka, and measures were taken place of disinfecting public transport and public places, especially with the commitment and dedication and contribution from Sri Lanka Police and Police Special Task Force. Moreover, regulating the distribution process of face masks were done by Sri Lankan government, especially face masks were being sold at over 10 or 20 times than the original price by the vendors. As a result, the country's drug regulatory agency placed price controls on face masks as well as it could be purchased from anywhere at a controllable price. Moreover, using electronic print and social media to educate the people about the disease has created a strong public opinion on the need of adopting preventive measures and maintaining personal hygiene among general public. Guidelines such as Guidance for Workplace Preparedness for COVID-19 and documents like Sri Lanka Preparedness and Response Plan COVID-19 were immediately disseminated through media so that people were educated on how to tackle the situation. Regarding the home delivery mechanism, a decision was taken to deliver medicines to homes of regular patients who have registered at hospitals with the support of divisional secretariats, public health officers, and security forces. It was also discussed to implement a system to distribute medicines through few locally selected pharmacies to patients who purchase medicine from private pharmacies. The extraordinary contribution carried out by Satosa and cooperative societies to distribute the essential goods to needy community members in rural and urban areas under the subsidized food items, along with the most effective social media apps and postal department services, must be appreciated. Private-public partnership has been arranged for an efficient distribution of essential goods and services to the affected people, with the main supermarket chains such as Cargill's, Apico Supercenter, Kiehl's Super, Satosa and Labs Holdings, Picnic and other private sector transport providers. When mentioning about the material and monetary benefits granted to low-income and vulnerable families and individuals, 5,000 rupees each paid to senior citizen allowance recipients, disabled persons, farmers who are registered under the Farmers Insurance Scheme, kidney patients and Samudra recipients, payment of the pensions to retired public officers, Triposha and other nutritional supplements to expectant mothers and malnourished children, relief on lease installments, and private businesses were also provided. Moreover, free transport, medical and medical testing facilities, and food stamps certificate for some of the beneficiaries and poor communities have been provided. And Sri Lanka could manage nearly 45 quarantine centers by the date 3rd August 2020. And it's essential to talk about Sri Lankan culture because Sri Lankan culture has played a major role in the prevention and tackling mechanism of COVID-19 in Sri Lanka. So Sri Lankan unique culture has provided some basic foundation for attitudinal change during this lockdown period. Especially Sri Lankans have quit smoking, drinking is under control, people are returning to Ayurvedic medicine and food habits and meals, expecting optimistic effects. And it's based on this culture that a flexible human community has been created to support the government's activities for loving religious practices and living in their homes. The importance here is raised as a nation to take care of the poor even in the face of oppression. So, Sri Lanka has adopted a preventive model. Performing religious rituals, praying the immediate recovery and control of the disease also have a mental and spiritual impact on people. And Sri Lankans are praying not only for Sri Lankans but for the whole world. Let's move on to the weaknesses identified by the SWOT analysis. So here you can see the low involvement from Disaster Management Center, District Secretary Office and Divisional Secretary Office. As the government announced the COVID-19 as an emergency situation, the regional objectives which needed to reach to the misadventure persons were carried out by the Disaster Management Center. A hotline has been established for the public to obtain or notify any details regarding the coronavirus situation, which was a joint collaboration with the Disaster Management Center. The distribution of the essential grocery and foods were obtained from the government stocks and private companies was responsibility of Grama Niladhari officer by identifying the people who needed the support from the government and under the authority of district secretary and divisional secretary. uh, the distribution of the goods per divisional secretary office. Rather than this, their involvement in controlling the status situation was very low and can be criticized as neglected or unnoticed, yet they could be strategically incorporated to maintain baseline database of the infected patients, which can strengthen the contact tracing mechanism. Moving on to the lack of community involvement, main stakeholders in the COVID-19 preventive mechanism was public health doctors and public health inspectors. General public has been asked to maintain proper hygiene methods and self-quarantine methods to safeguard from the disease. Main community involvement during the virus outbreak is the provision of essential food and other requirements to the people who has been unable to compensate. So it can be stated that community involvement was underestimated or unrecognized in the prevention and controlling strategy, unlike the other disaster situation due to equal vulnerability of everybody to this health pandemic. So regarding the impact on election postponement, on 19th March, Election Commissioner revealed that the 2020 Sri Lankan parliamentary election will be postponed indefinitely until further notice due to this coronavirus pandemic situation. But we should acknowledge the fact that Sri Lanka could continue, or Sri Lanka could operationalized the 2020 Sri Lankan parliamentary election amidst this COVID-19 situation successfully. So moving on to the stress-related issues due to lockdown, a study conducted by Lenadora and a few scholars has been unveiled the social media behavior of people during the lockdown period due to pandemic, which has found that most of the people were oppressed or depressed due to this lockdown situation, and in addition, observations have shown that social media has been used as a method of sharing valuable information as well as advice to raise public awareness and mitigate the pandemic situation. Regarding the loopholes in the legal framework, it should be mentioned that the Quarantine and Prevention of Disease Ordinance number 3 of 1897, where Sri Lankans could find out the protection and rights of disabilities are in risk position. Since services should be available to all citizens, including adults with disabilities, people with learning disabilities, people with disabilities, as well as marginalized groups, the legal framework of this Quarantine and Prevention Diseases Ordinance uh, should be work as an effective mechanism to prevent the spreading of contagious diseases, controlling difficulties in the time of health emergencies, and it should give much importance to human rights, including all human beings with vulnerabilities, disabilities, and also without vulnerabilities and without disabilities. Regarding the reporting lack for COVID-19, this reporting delay and decision taken so both on lockdown enforcement and relaxation, adequacy of medical facilities such as hospital beds, critical care facilities can also become unreliable. So the reporting delay is highly dependent on the amount of daily PCR testing conducted, which was the case of Valisara Naval Base that couldn't detect earlier. So fortunately, the number of daily tests increased later on with this unexpected emergence of naval COVID cluster. So the situation is quite good at the moment. So lack of preparedness or emergency plan in many institutions is another thing that I should highlight. Even though Sri Lanka was considered to be a disaster state by the Disaster Management Act number 13 of 2005, many of its institutions doesn't have disaster management or recovery plan, which is a major weakness. Henceforth, no action is taken to reverse the negative impacts of a disaster in the post-disaster recovery phase. Moving on to the opportunities highlighted by my study. First one is experimenting online teaching learning mechanism. So Sri Lankan education was continued in virtual teaching learning environments created by platforms like Zoom, Google Meet, SLT Meet, etc., increasing exposure to both teachers, lecturers, and students to digital technology, creating opportunities to incorporate them in future education too for easy and less time consuming handling of materials. Moving on to the second factor in the list, period of work from home for both public and private sector, I should mention that many countries have experienced this as an effective way of working. For example, through 3 to 2 ratio, 3 days working at the office and 2 days working from the home ratio. After calculating the number of square feet, units of electricity and water consumed, and the energy spent on air conditioning, etc., this way of human resource management can have subsequently positive repercussions for small scale enterprises which are at risk these days. Then I would move to the COVID-19 Healthcare and Social Security Fund. From the President's Fund, a special bank account has been opened at the Bank of Ceylon for tasks related to preventing the spread of the coronavirus and for providing the necessary healthcare and relief measures. For this purpose, 1 million I'm sorry, 100 million had been deposited from the President's Fund. Tax and foreign exchange control restrictions have been lifted for all local and foreign donors who wish to contribute to this fund. Another important finding was environment restoration. The air quality index has shown a drastic improvement in the quality of air in highly dense areas such as Colombo ever since the enforcing of indefinite curfews. Air pollution in Sri Lanka has declined in the last months due to the lockdown, and vehicular emissions are one of the main reasons for urban air pollution. So here in this picture you may see how Colombo city could be seen from Adams Peak due to the ambient air quality of Sri Lanka, while the air quality was improved with the lockdown curfews. Next important finding is cut down of imports which can motivate local production. The pandemic situation consequences include restrictions on imports from online marketplaces like eBay, AliExpress, and many more. This can be transitioned to an opportunity for local producers to market their products online with higher diversity of products and purchasing mechanism. Innovative thinking is needed to come up with better opportunities from the existing situation. Rather than employees, entrepreneurship should be encouraged for a creative economy. Another most important finding here is the strategic approach to develop the loss of tourism. Here you may see the strategic window which was open for Sri Lanka during this COVID-19 lockdown period. So redesigning of tourism products, acute positioning and robust destination marketing, dedicated hospitality service offerings with outstanding healthcare and safety services of the industry can lead to health and wellness of tourism and domestic responsible tourism. So the strategic approach can be utilized to the loss of tourism to compensate the loss of tourism as well as to improve the current state of tourism in Sri Lanka. Here in this picture you may see how the limited space balcony gardening or the endeavors like the home gardening challenge which was take place during this lockdown period has simultaneously increased the local food production in Sri Lanka. Moving on to the another important part of my study, which are the identification of threats related to the prevention and controlling mechanism of COVID-19 in Sri Lanka. The first threat which was identified is managing the extensively large public crowd, as you may see in this picture. Most social distancing measures executed in Sri Lanka achieve desired results through forced distancing but not through behavior change of individuals. Consequently, the threat of all the desirable effects achieved through social distancing taking a U-turn once the national level implementations are lifted persists. Maintaining the effectiveness of social distancing through individual behavior change remains the biggest challenge faced by public health specialists in Sri Lanka at present. Therefore, novel and effective strategies should be used to educate and promote desirable behavior change of the public at individual and family level. So the second threat identified here is the impact on tourism. The coronavirus outbreak further affected the downfall of the tourism sector of the country, which was recovering slowly from the impact of the 2019 Easter Sunday bomb blast. The tourism sector was directly affected with the decrease of Chinese tourist arrival as well. The outbreak of coronavirus COVID-19 pandemic has made a detrimental ripping impact on global tourism, and its direct dependence has been one of the most affected industries in the world at present. According to 2019 performance of the industry, approximately 5% direct GDP contribution and 5% of total employments of the country was from tourism, but now most of the employees are at risk of losing their jobs and experiencing salary cuts due to tourist arrival decline nearly 71%. Indirect employees are severely suffered from this situation. Moving on to the third point highlighted in the slide, the impact on education and entertainment. Sri Lankan government imposed ban on public gatherings. So film theatres, national parks, zoological gardens and botanical gardens throughout the country have been closed for a moment, and also ordinary level and advanced level examination were postponed, shaking the mindset of students, while those who could afford continued an education online were students, and those who didn't have adequate network coverage failed to accomplish equal education rights, being unfortunate. This was common from preschools to postgraduate education when considering the device facilities, accessibility, and skills needed. So this can have negative impact on their later performances, grades, and marks. But however, it should mention that Sri Lanka could successfully conduct the advanced level examinations, which is decisive in selecting students for national level universities successfully during this pandemic situation, which is a plus point that I should highlight here. And when moving on to the economic collapse, the Colombo Stock Exchange closed at a new 8-year low amid the coronavirus fears. Moreover, macroeconomic implications shows greater potential of increasing poverty incidence related to all poverty types, including extreme poor, poor and vulnerable non-poor under present pandemic situation. Moving on to the mental breakdowns which can lead to deterioration of human capacities, the persons under quarantine will be most likely to have a weakened immune system owing to fear, resentment, and stigma as they feel victimized to an unnecessary extent. As mentioned by Chandraseri and few scholars, Sri Lankan Navy soldiers who underwent quarantine recently are a case in point. They were portrayed as criminals, and barred access to social life, imposed regulation, and prohibition of certain activities will worsen the mental condition of the individuals, increasing their stress levels. And when coming to the topic of more burden on women's triple role, during disease outbreaks, women endure additional burdens associated with paid and unpaid work, often without consideration or the alleviation of other life responsibilities. The gender division in productive and reproductive work and community activities in the context of disaster adds more mental agony on women than men. They are also responsible for taking care of old aged people and infants, leading to severe mental shocks that can cause traumatic diseases in the latter stages. Women will endure a worsening of their burdens until the pandemic is well under control and for a long time after. Public policy and health efforts have not sufficiently acknowledged the issues concerned with association between gender and disease outbreaks, even in the Sri Lankan context. So, let's move on to the conclusion. So, COVID-19 as an unexpected disaster for a country like Sri Lanka has sent us a message which we need to read with insight. As mentioned by Silva in his study in 2020, both strategic thinking, that means doing the right things, and tactical thinking, doing things right, are momentously decisive and imperative in this context of COVID-19. So it is very important to realize that shortcomings are common to many countries at the beginning, and very few countries are manifesting a greater speed in actions to control the coronavirus COVID-19, where Sri Lanka in a better position with its own success story. So let me go for the recommendations. In recommendation section, you may see further enhancing proper public awareness, education, and social distancing while providing essential health facilities in all public locations, and enforcing regulations like making the face mask a mandatory requirement for traveling to curb local transmission of the virus is essential and important, and allocating necessary consultations and authoritative power to relevant institutions, departments, facilitating decision-making process is important, and further utilizing social media to channel the accurate and timely required reliable information. For instance, the Viber group of Health Promotion Bureau, which I have already subscribed, is of importance, and incorporating the lessons learned and best practices from the regional success stories into national level emergency planning. For instance, providing health services overwhelmingly at right time to right people vulnerable to the virus by ensuring its triage effort. And further recommendations, as you can see here, further studying the specific strategies of prevention and control, like national influenza pandemic plan initiated by New Zealand, and electronic surveillance measures with artificial intelligence, AI technology may be utilized in drones, which is practiced now in Sri Lanka, to make people aware and as well as to contact tracing. Mass testing, free hand sanitizers, and government rationed face masks at pharmacies in South Korea, etc., can be considered as the regional success stories and good practices that we can also adapt into. And developing a monitoring and evaluation system to assess effectiveness and impact of planned measures through frequent survey, focusing on practicing self-sufficiency, utilizing local knowledge and skills, especially the indigenous knowledge uh, stored with the local communities, especially in rural Sri Lanka. National disaster management plan and capacity building network with public and private sector investments and collaboration, increasing training and development for online remote working, strengthening health and safety measures everywhere to offer a hygienic environment, legal enforcement for pay cuts instead of layoffs that results in mental stress and breakdown of employees, expanding the scope of social science research regarding the new normality like virtual spaces, digital inequalities, data poverty, and necessity of new skills as a citizen of a developing country in order to decide which parts of normality that is worth of returning. So here are a few selected references. Actually, I utilized many more research articles, but I couldn't include all of these into this reference slide because then it would be overcrowded, as you can see here. So here are a few selected references which I referred for this desktop review. So thank you for your attention regarding my presentation, and have a safe evening. So you can contact me. Don't hesitate to contact me via my personal email address, as you can see here, Isurika327@gmail.com. So let's meet at the question and answer session. Have a nice day.